So this is how I would like to start my presentation, and this is how I'm going to run my presentation. I'm going to give a brief introduction about what is social recession and how the current pandemic has affected us in terms of our mental health and the physical health. What symptoms you would have been experiencing for the last few months, what coping strategies you should employ to for their mental and mental health, and in the end, I would give a brief summary about the presentation. So I'm sure a lot of people must have heard about this word called double pandemic, which has been quite in the news, social media. And we all know we are in this pandemic, which we've never seen before. And this is something very new to all of us, which has obviously threatened our physical health. And the way it has affected us economically in terms of job cuts, pay losses, affecting our livelihoods, and we are very much aware of that we call is that economic recession affecting the economies worldwide and globally. But I think something which we all have just started realizing is what COVID-19 has done to our mental health is something which is called a social recession. And what has caused social recession is the social restrictions that has been placed on us in terms of quarantine, social distancing, unable to go back home, closure of schools, working from home, and all that has affected our social networks and have caused something which we term as social recession. So to be more precise, what social recession means. Social recession is a loss of sense of belonging to a community, which is as a result of a collapse in our social contacts, fraying of our social bonds with the family and friends. And this obviously affects our mental state, our moods, our mental health, our ability to work, and our ability to do our day-to-day functioning. So why social contacts and social networks are important for us? As we all know that we are humans, are social species, and we need that social touch and social contact for us to be resilient. And as soon as you've been asked to be socially distanced for whatever reason, increase in stress is a very normal response for any of us. For example, if you're thirsty or if you're hungry, your body signals you to eat and to drink. So similarly, social distancing is kind of a biological drive, which your body is signaling you to reconnect. Because when you're close to your loved ones, your family and friends, that gives you a sense of safety and gives you resilience. And lack of that proximity to your trusted others, which are your family or friends, leads your body to go into a flight and a fight response with a state of heightened alert that has a lot of implications on your physical and your mental health. And I'm sure all of us has experienced this in some degrees in the last few months since we've been in the pandemic. So what can cause social isolation? Apart from the current pandemic for the last 4 months, social isolation can be imposed through death of your loved ones, your family and friends moving away, you moving to a different city, impaired mobility because of certain physical health reasons, and also certain mental disorders. So what are the categories which are at a high risk of social isolation? Technically speaking, pretty much all of us, but there are some categories which can be a little bit more of a high risk category. especially the elderlies, because of certain chronic physical health problems, reduced mobility, children and teens, people with chronic disease and disabilities, and especially people who have a history of previous mental health. So talking about social isolation, it just not that the social isolation has come to our notice in the current pandemic. It was very much there and has been a hot discussion topic in many of the mental health forums because it has a huge impact on our mental health, which is evident to all of us now because of stay-at-home restrictions, the quarantine, the social distancing, not seeing your families, and this has already exacerbated a serious problem which has a huge impact on our mental illness. And the recent studies in the last few months since we've been in the pandemic has shown that loneliness have increased by 30% and emotional distress has tripled. So what physical effects the social isolation and recession has caused? And as I have discussed in the previous slides, that we human beings are social species and we need that social contact with our loved ones. And if the social networks are impaired and you're not allowed to see your trusted ones, so that lack of proximity causes a distress in your body. And that leads you to a fight or flight response that have implications on both your physical and your mental health. So in terms of physical health, you could start noticing your heart rate going up, your increased blood pressure, your BP might rise. It have a huge effect on your metabolism. Tummy upsets, heartburns. People who are diabetic would see changes in their blood sugar levels, increased level of stress hormones, and if people who already have pre-existing physical health conditions, they notice the worsening of their physical health. Now, coming on to the impact what the social recession has caused on our mental health, which is the topic of today's discussion. Before I go into that detail, I would want to give you an example to be more precise and for you to understand things, how this COVID-19 has affected us in terms of our mental health. So this was a patient who I saw this morning, and which was a classical example of how COVID-19 has affected all spheres of your life. So she is a young lady in her 30s. She works in sales, single, lives with her mom. Parents separated when she was 17. So the dad lives in a different city in UAE and has a younger brother who lives with her dad. So she and her mom are the single earners in the family. She works as a sales and mother works as a teacher. So before the pandemic, she was quite active, no previous mental health history. She used to travel a lot with her job. So since the pandemic, it has affected her. It has effect on her job because sales were affected hugely because of the pandemic, and that caused a lot of stress. She wasn't traveling, and that took a lot of toll on her mental health because she used to love traveling and meeting people. So that has stopped. She is not meeting people because she's worried that she might get the virus. And more so, she's worried about her mom because she is in her late 60s. So she thinks that if she gets the virus, she might be able to come out of it. But her anxiety is around that she might give it to her mom. So her social networks are completely disrupted. And also she is washing her hands. I mean, we all are washing our hands and sanitizing, but I think she's doing it number of times, and she started having cracks in her hands. So if you if you see how COVID-19 has affected her in terms of her in terms economically, because that has huge effect on her job in terms of sales. That has caused her stress because she is the one who's responsible for the finances in her home. Her networks are disrupted, her social networks, because she's worried that if she go out, she might just get the infection, or she might give it to her mom, and that has caused a lot of anxiety and stress. So discussing about what symptoms you can have because of the current pandemic and because of the social recession it has caused. So especially the people who have a history of previous mental health issues, so they might be more in a high risk category, and it's important for them to acknowledge that the symptoms sometimes might get worse, and they have to take a little bit more extra care than the rest. So you could see worsening of anxiety and depression and OCD of people who have already got a history of these disorders. In my clinic, I've been seeing loads of these patients in the last few months. I referred from the neurologist with complaints of headache, from gastroenterologist with stomach ache, acidity, finding it difficult to concentrate, not sleeping, mood changes, relationship issues, because now most of the people were working from home the last 6 months, increased incidence of domestic violence, substance abuse, because many people are trying to cope with this stress and anxiety, and risk in suicidal behavior. So most of these symptoms are the result of the anxiety that we've been going through and the stress for the last few months because of the social isolation. Now, coming on to the strategies and the treatment of how do we deal with it, which this is something which we have never seen. So the most important key message which I want to say is that it's okay not to be okay. And I'm sure most of you have read or heard in social media that it's okay not to be okay. And it's important to realize that any kind of emergencies are always stressful. And COVID-19 is something which has hit everyone globally, universally, and this is something which we have never seen. The number of the stresses which are coming out of this pandemic is from number of sources. The most important is getting the virus. Am I going to get the virus, or am I going to get the virus and transfer it to my loved ones? The consequences this pandemic has on my work, on my livelihood. And the second element is the forced adaptation that we have been asked to do for the last 6 months or few months, in terms of the way we used to do our grocery shopping, or for example, going to work, or our children's education. So everything has just taken a drastic change, and that we have been asked to adapt to this new norm. And I think most importantly, the strain which it has put on our social networks. I would just want to discuss an important thing about resilience, which we human beings has, and this resilience does not come as from an individual. So we do have these resilience because of our social networks, because of our families and friends, and because there has been a lot of strain put on the social networks because of the restrictions. This resilience at this point of time has just completely gone downhill, which is giving rise to increased incidence of mental health problems, and primarily more so anxiety about a lot of things, and exacerbation of existing mental health problems. So how do we deal with it? It would be difficult for me to suggest just one strategy that works for all, because we all are different. But from gathering from the expert opinions, from researchers, there are few strategies that have come up. But as we all are in it together, we all are learning. So I think the most important thing at this point is what works for you. Finding out a strategy, a coping mechanism that has worked for you in the past, and try to implement it. The most important thing, which I would want to emphasize as one of the strongest strategy for your mental health, would be acknowledging or accepting. Accepting that the situation is difficult to control. We can't control it. Accepting that there would be a degree of stress. Accepting that there would be a degree of anxiety. And accepting that it is an uncomfortable feeling, it is challenging, but finding out strategies or coping mechanisms that you can come to terms with it or have peace with it. So it becomes a little easier for you to kind of get on with your day-to-day life. And acknowledging that it's quite normal to feel anxious and lonely, and most importantly that we all are in this together, and even though we want it to go away, but unfortunately it is there to stay for a while before we can say that it's gone. So the strategies to support your mental health is challenging your negative thoughts. And I'm sure many of you would have experienced that if you have a negative thought, it affects you in terms of emotionally. You get a negative emotion, and then you do something or act out in a way which is unhelpful. So to give you an example about how negative thought affects you and the traps that you fall into and the vicious circle is, for example, there's a shipment of an N95. So this is something which they are all real life scenarios which I tend to hear in my clinic. Is one of the patients just came to me last week and said, "Oh, the N95 has just run out of stock in the pharmacies," and I contacted a pharmacy, and the pharmacist told me, "Yeah, the shipment is delayed." So the patient started panicking, and he said, "Oh, I have an appointment in the hospital. And if I don't wear a 95, I'm going to die of it." So if you start thinking about it, which can be a possibility that you might get infection, and it can take a toll on your physical health. But then you kind of think that, is that a balanced thought? Or am I thinking something which is like an extreme or a worst possible outcome? So you try to reframe your thoughts in a way that does not provoke a negative emotion, and then would not lead you to act in a way which is unhelpful. The other element of it is limit the intake of the stressful information. I know for the last 6 months, we all have been glued to the social media, the news, and it's very difficult to keep away from the social media. But I think it's important to realize that you need to limit the information, and you have to be smart enough to kind of see how much information you want to listen and when. It's important to be aware of what's going on in surrounding, but I think limiting the intake would help you in terms of the mental state, because I think, as we all know, that COVID-19 is a stressful situation. So by listening to news, reading things in social media, you're constantly exposing yourself to a stressful situation. which then obviously leads to the flight and flight response and activate those areas in the brain that leads to anxiety, lack of motivation, mood swings, and number of other symptoms which we have discussed before. Staying connected, I cannot emphasize the importance of staying connected and how we feel at this point of time for the last and during the last few months, and how important it is to be with families and friends. So staying connected, especially through social media, in terms of Zoom calls or Skype, which I know is not the same as a face-to-face contact, but I think it's more of a proxy compared to the face-to-face contact which we can have with our loved ones. Managing your physical health is really important, and I think the physical health have a huge impact on your mental health. So staying active, exercising, eating healthy is more so important in the last few months when most people are at home. Focusing on what you cannot control. So more focus should be on what you can control. So you can't control how the pandemic is going to progress in the last 4 months. In few months, you can't control a lot of things. You can't control how people work at your workplace. So instead of that, focusing on what you can do in terms of your local environment, in terms of your relationships, in terms of your work, in terms of your children, in terms of your family, and in terms of your physical space and your physical health. So I think focusing more on that would lessen your stress and your anxiety, and makes you more in control of your surroundings. Talking a little bit about good coping and bad coping, I think we as individuals have different coping mechanisms, and there's nothing wrong about how we cope and how we have coped in the past, and we should not be judgmental about the other individuals' coping mechanism. But I think to categorize, I would place them as a healthy coping mechanism, a healthier and not so healthy. So many people in the last few months during the pandemic, few of them have adopted some lifestyle some coping mechanism which are not as healthy, as going to substance abuse, to give you a few examples, increased alcohol consumption, which could be termed as less healthy mechanism. All right, this is the slide about how you control your day. So this was something I was talking in the previous slide. So controlling things which you can control. So creating a schedule, maintaining routines and sticking to it, sleeping and waking up at the same time as we were doing before the pandemic, eating a balanced diet, practicing yoga or meditation, going for walks, and any kind of physical exercise which you like. So other activities, I'm sure many of you and we all have in those last few months have done what we always wanted to do, like watching your favorite TV shows, reading your favorite book, which you've always thought, but you didn't have time, joining in online activities. And I think many of the adults and children are still doing lots of online courses. Children are doing online piano lessons or music lessons. So I think it's important to keep yourself busy in what you like or developing a hobby. I think many people have, during the pandemic, have developed a hobby, be it gardening or cooking or baking or playing an instrument. And I think it is important and an important part of your mental health. So there's a little chart on the side which you can just go through it. So it's kind of summarizes what I've talked about: reading a book, listening to music, taking deep breaths, counting slowly, especially for children, exercising, coloring, drawing, And talking to an adult, people who have children, it's important to keep a check on children and talking to them time to time how you're feeling, and taking a break if you feel stressed. So I think this is pretty much about what I've talked in the previous slides. So setting your priorities, setting reasonable goals each day, which you think you can achieve, and whatever you have done during the day, and giving yourself credit and applauding yourself and appreciating, and pursuing your projects which you always wanted to. And but I think it's very important that you take a break if you need it, and don't try to be a superhuman being. Controlling your socializing. So I think we most of us, we know that social distancing only means physical distancing. So you can still be connected, and I think, and I'm sure we all of us are doing that for the last few months through Zoom calls and Microsoft Teams. This presentation I'm doing on Microsoft Teams. So I think the digital media is really important during these times, but and it's important to stay connected, because proximity to your loved one always increase your resilience. So this is a little summary of what we have talked about. So if you live with your family, so spend quality time offering support to others, especially the elderly and people who live alone. So little things. If there's an elderly couple living to your house, offering them help in terms of grocery shopping, or checking with them time to time if they're okay, if they need any medications. And I think virtually we have talked about that, and expressing gratitude. All right, now coming on to when you seek help, what I discussed in the previous slides were the feelings and emotions that we all have gone through in the last couple of months during the COVID-19 pandemic, and especially because of the social isolation, feeling helpless, feeling trapped into it, and wanting to go, feeling sad, angry, irritable, anxious about getting the virus, finding it difficult to concentrate, and not eating properly, multiple aches and pains, not sleeping, unable to enjoy things, and more so for people who are working from home, and the children are at home. So it's more of a stressful situation at home, just because you've been asked to work from home, and most of the children are doing homeschooling. So it's a difficult situation to handle, and it's challenging. And you would go through all these emotions and all these symptoms which I've outlined to some degrees, and I'm sure all must have gone through it in varying degrees in the few months. But realizing that that now it's a little over the board. It's just impacting on my mental state, and making me feel miserable. You are finding it difficult to handle your daily activities, finding it difficult to find pleasure out of things, getting mood swings, feeling low most of the time, and everything seems to be an effort. Then and for a number of weeks and months, and I think probably then probably it's time for you to ask help from a professional. So who to seek help? Obviously, it's a professional. So if you feel overwhelmed, stressed, or anxious, and it gets into your ways of your daily activities for several days, weeks, or months, then it's best to seek help before it's too late. So we've talked about how social recession and social restriction has affected us physically, and had a huge impact on us, and it's going to have a huge impact in coming few years, till we return back to the normality or the new normal. But everything isn't that gloomy, and there's something which I think probably each of us has learned from this pandemic, and we're still learning. I think on a different perspective, it would be an opportunity for us to step back and ask if we're leading the kind of lives that we always wanted to lead, and our chance to ask ourselves whether people fit in our priority list, and whether there's a gap between the stated priorities and our lived priorities. So stated priorities means that what we say that we want to do, but on the contrast, we just do a completely different of what is the stated priorities. So is there a gap between that? And how do we fill that gap? So this might be an opportunity for you to close this gap. And I'm sure many of us realized this, that our relationships matter deeply to us. And then they're not just nice to just have them, and they are necessary to have and for us to build our resilience. So a few questions that I'll leave you to think over, which we ask ourselves time to time, and we would be asking when life returns to a new normal. That's when all of this is over, will we prioritize our social connection that means so much to us? And this is what the pandemic has taught us. Will we still learn to live in the moment, or will we go back to what we were doing before the pandemic? Will we continue to appreciate the value of social relationships? And it's very true that this pandemic will have long-term effects on all of us, psychologically and physically. But do we have strength and resilience to acknowledge it and move forward when we return to the new normal? So, a little summary about the pandemic. The impact of, obviously, this pandemic has touched every one of us, physically and more so, mentally. And this is something which we have never experienced. And this pandemic would be a reminder for many of us for years to come, for us to teach the importance of social connection. Thank you so much, and stay connected. Audience. Are there any questions that the audience would want to ask? Either they're all sleeping or they are very smart that they've understood everything. All done? Okay.